Good morning, everyone. It's me, Sanju Pandit. Welcome back to channel Medical with Sanju. I hope you all are fine. Nepal Nursing Council based model exam set here देथ्यौं हामी. NNC set 19. Question number 1. The process of blood cell formation is called. Option A. Thrombocytosis. Option B. Leucocytosis. Option C. Erythropoesis or Haemopoiesis. And option D. Hemolysis. The process of blood cell formation is known as erythropoiesis or haemopoiesis. Option C is right answer. Question number 2. Vegans are susceptible to which vitamin deficiency? Option A, vitamin A. Option B, vitamin D. Option C, vitamin B12. And option D, vitamin C. Vegans are susceptible to vitamin B12 deficiency. Option C is right answer. Question number 3. Which of the following immunoglobin is found in human milk? Option A, IgG. Option B, IgA. Option C, IgM. And option D, IgD. 5 वटा immunoglobin हुन्छ. IgG, IgA, IgM, IgD and IgE. यो सबै चाहिँ हाम्रो बडीमा हुन्छ. 5 वटा इम्युनोग्लोबिन. इम्युनोग्लोबिन मिन्स एन्टिबडीज र मिल्कमा ह्युमन मिल्कमा IgA पाउँछ. Option B is right answer. Question number 4. Which of the following carrying oxygenated blood to the heart? Option A, pulmonary artery. Option B, aorta. Option C, pulmonary veins. And option D, pulmonary artery. कुन ब्लड भेसलले अक्सिजनेटेड ब्लड हार्टमा लग्छ? पल्मोनरी भेनले लग्छ. अप्सन सी इज राइट आन्सर. पल्मोनरी आर्टरीले डिअक्सिजनेटेड ब्लड राइट भेन्ट्रिकलबाट पल्मोनरी आर्टरी हुँदै लङ्समा लग्छ. लङ्समा प्युरिफाई हुन्छ, अक्सिजनेटेड बन्छ र त्यहाँबाट अक्सिजनेटेड ब्लड पल्मोनरी भेन हुँदै लेफ्ट एट्रियममा जान्छ. क्वेशन नम्बर 5. Which of the following cranial nerve sheaths deals with the sense of sight, vision? Option A, CN1. Option B, CN2. Option C, CN3. And option D, CN4. Option B is right answer, CN2. First मा आउँछ CN1, olfactory. यो sensory हुन्छ. It deals with the sense of smell. Then 2 नम्बरमा optic. deals with the sight अथवा vision. 3 नम्बरमा oculomotor, eye movement मा यसले हेल्प गर्छ. and 4 नम्बरमा trochlear आउँछ भनेको motor function यसले गर्छ. It enables the eye to move inward or downward. Question number 6. The structure which allow digested food material to pass from small intestines into the large intestine is. यहाँ चाहिँ small intestine बाट large intestine मा हुन्छ. The right answer is option C, ileocecal valve. The ileocecal valve is located between the ileum and cecum को बीचमा चाहिँ हुन्छ. Its function is to allow digested food material to pass from the small intestines into large intestine. Question number 7. The gland is located in the mediastinum of thoracic cavity, anterior and superior to the heart, which is associated with the immune system. Option A, thyroid gland. Option B, parathyroid gland. Option C, thymus gland. And option D, pituitary gland. Thymus gland ले help गर्छ. The thymus is a soft, roughly triangular organ located in the mediastinum of the thoracic cavity. Question number 8. Histamine is potent inflammatory mediators. Histamine is released by option A, basophils. Option B, mast cell. Option C, eosinophil. And option D, erythrocyte. Option B, mast cell. Mast cells play a central role in an inflammatory and immediate allergic reaction. They are able to release potent inflammatory mediator such as histamine. Question number 10. Which of the following is the first priority in preventing infections when providing care for a client? Option A. Wearing gloves. Option B. Hand washing. Option C. Wearing gown and goggles. And option D. Wearing mask. Hand washing option B is right answer. Hand washing remains the most effective way to avoid spreading of infection. Question number 11. Which client is at risk for the development of potassium level of 5.5 MEq per L hyperkalemia? Option A. The client with colitis. Option B. The client with the Cushing syndrome. Option C. The client who has been using laxative for a long time. And option D. The client who has a sustained traumatic burn. The client who has sustained traumatic burn. Option D is right answer. Question number 12. On review of medical records for 4 clients, the nurse determines that which client is at risk of fluid volume excess. Option A. The client has chronic kidney disease. Option B. The client who required intermittent gastrointestinal suctioning. Option C. The client with an ileotomy from the recent abdominal surgery. And option D. The client taking diuretics. कुन पेशेन्टलाई चाहिँ फ्लुइड भोल्युम एक्सेस हुन सक्छ कुन पेशेन्टमा? The client with chronic kidney disease मा चाहिँ हुन सक्छ. Option A is right answer. Question number 13. The nurse caring for a client who has been receiving intravenous IV diuretics suspects that the client is experiencing a fluid volume deficit. Which assessment finding would the nurse note in a client with this condition? Option A. Increase heart rate and lungs congestion. Option C. Decrease hematocrit and increase urine output. Option C. Increased blood pressure. And option D. Weight loss and poor skin turgor. Weight loss and poor skin turgor बाट चाहिँ थाहा हुन्छ फ्लुइड भोल्युम डिफिसिट छ भने. Question number 14. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client for manifestations of which disorders that the client is risk for. Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. And option D. Respiratory alkalosis. It's a option B. nasogastric tube छ र त्यसमा चाहिँ सक्सन लगाएको छ भने चाहिँ के हुन्छ इन्ट्रासेलुलर फ्लुइड लस हुन सक्छ र इन्ट्रासेलुलर फ्लुइड लस भयो पोटासियमको लेभल कम हुँदै जान्छ भने त्यो भनेको चाहिँ अल्कालोसिस तिर जान्छ मेटाबोलिक अल्कालोसिस. त्यसमा के हुन्छ हाइड्रोजन आयोन चाहिँ लस भएको हुन्छ डिक्रिज भएको हुन्छ एन्ड एसिड अथवा एक्सेस बेस चाहिँ बनेको हुन्छ बाइकार्बोनेट. क्वेशन नम्बर 15. A client with a 4 days history of nausea and vomiting present to the emergency department. The client is hyperventilating and has a respiratory rate of 10 breaths per minute. Electrocardiogram ECG monitor displayed tachycardia with a heart rate of 120 beats per minute. Arterial blood gas are drawn and the nurse review the results, expecting to note which finding. Option A. A decreased pH and an increased PSO3. Option B. An increased pH and decreased PSO3. Option C. A decreased pH and a decreased PSO3. Option D. An increased pH and an increased HCO3. An increased pH and increased HCO3. Client experiencing nausea and vomiting would most likely present with a metabolic alkalosis, and symptoms experienced by the client would indicate hypoventilation increase. Symptoms experienced by the client would include hypoventilations and tachycardia. Option A is a respiratory acidosis. Option B is a respiratory alkalosis. And option C is a metabolic acidosis. Question number 16. A client on a chemotherapy has a WBC count of 1200 per mm. Based on this data, which nursing action should be taken first? Option A, monitor urine output. Option B, check temperature for hourly. Option C, obtain an orders for blood culture. Option D, assess for bleeding gums. WBC को काउन्ट चाहिँ कम देखाएको छ 4000 देखि लिएर 11000 सम्म चाहिँ WBC को नर्मल काउन्ट हुन्छ तर यहाँ 1200 मात्र देखाएको छ सो चाहिँ 4 आवरली टेम्परेचर चाहिँ चेक गरिराख्नु पर्छ अप्सन बी इज राइट आन्सर इट इज इम्पोर्टेन्ट टु मोनिटर फर इन्फेक्सन व्हिच वुड बी एभिडेन्स्ड बाइ एन एलिभेटेड टेम्परेचर्स इन अ क्लाइन्ट हु हैज शो अ लो WBC काउन्ट क्वेश्चन नम्बर 17 Mr. Jones come into the doctor's office with his wife. During the initial interview with the nurse assessing the reasons for the visit, the wife said that her husband has been feeling bad for 3 days. The nurse noted that this is what type of data? Option A, primary objective data. Option B, secondary objective data. Option C, primary subjective data. And option D, secondary subjective data. यो secondary subjective data भयो question number 18 a 40-year-old unconscious patient is in ICU a duty nurse is going to provide oral care to the patient which would be the best positions for the patient option A Sims position option B prone position option C sideline position and option D high flower position Option C, sideline position is the right answer. Option C हुन्छ यहाँ right मा. Proper positioning can help to reduce the risk of aspiration. So, unconscious patient मा best position भनेको sideline position हुन्छ. Question number 19. When you are walking on the road, you come across a victim lying in the middle of the road that appears to be unconscious. You should Option A, call for emergency. Option B, call for help. Option C, drag the victims out of the roadway and call for emergency. Option D, give CPR. Option C is the right answer. Drag the victim out of the roadway and then call for emergency. कुनै पनि patient unconsciously बाटोमा छ भने फर्स्टमा त्यो चाहिँ त्यो पेशेन्टलाई सक गर्नुपर्छ हैन हलाउनु पर्छ आर यु ओके भन्नु पर्छ देन त्यो भिक्टिमलाई चाहिँ त्यो डेन्जर ठाउँबाट उठाएर सेफ्टी ठाउँमा ल्याउनु पर्यो देन कलको लागि हेल्पको लागि चाहिँ बोलाउनु पर्छ त्यसपछि इमर्जेन्सी कल गर्नु पर्छ क्वेशन नम्बर 20 many victims of earthquake were left without their homes food and water basic necessities for living based on Maslow hierarchy of needs which motives were activated for these individuals option A security option B self-actualization option C physiological and option D belongingness physiological need मा पर्छ यो option C is right answer question number 21 a patient is scheduled for a urinary catheterization in which positions should the nurse place the patient option A dorsal recommend position option B Trendelenburg position option C supine position and option D prone position dorsal recommend position चाहिँ मेन्टेन गर्नुपर्छ option A is right answer यो फिमेल मा हुन्छ र मेल मा supine position मेन्टेन गर्नुपर्छ question 22 when the elevated temperature rises and falls to normal every day this type of fever is called option A constant fever option B remittent fever option C intermittent fever and option D relapsing fever fever chapter बाट एउटा क्वेशन स्योरै आउँछ यसको आन्सर चाहिँ option C हुन्छ is a intermittent fever यसको डिस्क्रिप्सन्स यो भन्दा पहिलाको सेटमा भइसकेको छ क्वेशन नम्बर 23 Physician prescribed a hypotonic solutions IV for a client. Which of the following IV solutions would the nurse expect to prescribe? Option A 5% dextrose in water. Option B 10% dextrose in water. Option C 0.45% sodium chloride and option D 0.9% sodium chloride. Isotonic हुन्छ 0.9% sodium chloride, 5% dextrose, and 0.45% sodium chloride is a hypotonic solution. Option C is right answer. Question number 24. IV heparin therapy is ordered for a client. While implementing this order, a nurse ensured that which of the following medication is available on the nursing unit? Option A vitamin K, option B amino acid, option C potassium chloride, and option D protamine sulfate. हेपारिन दिने बेलामा प्रोटामाइन सल्फेट चाहिँ अभाइलेबल छ कि छैन यो चाहिँ हेरिराख्नुपर्छ. अप्सन डी इज राइट आन्सर बिकज प्रोटामाइन सल्फेट इज अ एन्टिडोट अफ हेपारिन. Question number 25. Doctors order infuse 1200 ml of 0.45% normal saline at 125 ml per hour. Drop factor 12 GTT per minute. How many GTT per minute will you regulate the IV? Option A 2, option B 12, option C 25, and option D 27. Option C 25. Question number 26. A nurse is going to provide back care to an older bedridden patient. On assessment, patient noticed red intact blisters at the sacrum area of the patient. While writing assessment report, nurse mentions bedsore as stage. Option A stage 1, option B stage 2, option C stage 3, and option D stage 4. यो स्टेज 2 मा पर्छ. अप्सन बी इज राइट आन्सर. स्टेज 1 मा ब्लिस्टर चाहिँ फर्म भएको हुँदैन बट मेबी यो पेनफुल हुन्छ चाहिँ यो. सेकेन्डमा ब्लिस्टर फर्म भएको हुन्छ. थर्डमा फुल थिकनेस स्किन चाहिँ यसमा इन्भल्भ भएको हुन्छ. एन्ड फोर्थमा यसमा बोन टेन्डन मसल सबै चाहिँ इन्भल्भ भएको हुन्छ. क्वेसन नम्बर 27. Nurse is caring for a client with an ongoing transfusion of packed RBC. When suddenly the client is having difficulty of breathing, skin is flushed and having chills, which action should the nurse joy take first? Option A administer oxygen, option B place the client on drop light, option C check the client's temperature, and option D stop the transfusion. Immediately first मा stop the transfusion. Option D is right answer. त्यसपछि vital signs चाहिँ चेक गर्नुपर्छ. Question number 28. A client is receiving a first time blood transfusions of a packet RBC. How long should the nurse stay and monitor the client to ensure a transfusion reactions will not happen? Option A 15 minutes, option B 30 minutes, option C 45 minutes, and option D 60 minutes. Option A 15 minutes. फर्स्ट मा चाहिँ 1 hour सम्म 15 मिनटमा चाहिँ भाइटल साइन लिइराख्नुपर्छ र खास गरी चाहिँ फर्स्टको 15 मिनट्स हुन्छ त्यो चाहिँ अब्जर्भ गरिराख्नुपर्छ त्यो टाइममा. क्वेसन नम्बर 29. Nurse is caring for a client receiving a transfusion of packet RBC. The client started to vomit and to be nauseous. The client's blood pressure is 95 to 40 mm of Hg from a baseline of 110 per 70 mm of Hg. The client's temperature is 100.5 degree Fahrenheit orally from a baseline of 99.5 degree Fahrenheit orally. The nurse understands that the client may be experiencing which of the following? Option A circulatory overload, option B delayed transfusion reaction, option C hypokalemia, and option D septicemia. Option D septicemia. Septicemia happens with the transfusion of blood that is contaminated with a microorganism. Assessment include rapid onset of high fever and chills, hypotension, nausea, diarrhea, vomiting, and shock. Question number 30. What should be the pressures on suction apparatus Option A 120 to 150 mm of Ag. Option B 100 to 110 mm Ag. Option C 80 to 180 mm Ag. And option D 70 to 60 mm Ag. The right answer is option A 120 to 150 mm of Ag चाहिँ suction को pressure हुन्छ suction aperture को. Question number 31. Which is the most common poisoning in Nepal? Option A organophosphorus poisoning. Option B lead poisoning. Option C kerosene poisoning. And option D mercury poisoning. The most common poisoning in Nepal is organophosphorus poisoning. Option A is right answer. यो चाहिँ adult मा हुन्छ र child मा kerosene poisoning common हुन्छ. Question number 32. What should be the amount of enema solution for adult? Option A 750 to 1000 ml. Option B 300 to 500 ml. Option C 250 to 350 ml. And option D 150 to 250 ml. Adult मा 750 to 1000 ml सम्म चाहिँ enema solution हुन्छ. Option A is right answer. यो चाहिँ adult को. Adolescent मा 500 to 750 ml enema solution चाहिँ दिन्छ. School age child मा 300 to 500 ml. Toddler मा 250 to 350 ml and infant मा 150 to 250 ml. Question number 33. What is the appropriate size rectal tube for adult? Option A 12 to 80 fr. Option B 19 to 21 fr. Option C 22 to 30 fr. And option D 32 to 38 fr. Adult को सोधेको छ. Adult मा 22 to 30 fr हुन्छ. Option C is right answer. And child को केस मा 12 to 18 fr हुन्छ. Question number 34. It is defined as any subjective or objective departure from a state of physical, mental and social well-being. Option A. Option B. Incidence. Option C. Morbidity. And option D. Fertility. Morbidity. Option C is right answer. Question number 35. In what degree the subcutaneous injection is given? Option A 45 degree, option B 25 degree, option C 30 degree and option D 60 degree. Subcutaneous injection 45 degree मा लगाउँछ. Option A is right answer. कहिलेकाहीँ अब intravenous को intradermal अनि IM को पनि सोधिराखेको हुन्छ. Intramuscular IM injection 90 degree मा दिन्छ. Subcutaneous 45 degree भइहाल्यो. त्यसपछि intravenous 25 degree मा लगाउँछ र intradermal 10 to 15 degree मा लगाउँछ. Question number 36. Length and gauge of needle used for subcutaneous injection is option A 5/8 inch 25 or 27 gauge, option B 1 to 2 inch 22 gauge, option C 3 to 4 inch 25 gauge, option D 3 to 4 inch 23 gauge. Subcutaneous को सोधेको छ. Subcutaneous 5/8 inch 25 और 27 gauge को हुन्छ. Option A is right answer. Intradermal 26 to 27 gauge को हुन्छ. Intramuscular 21 to 23 gauge को. Intravenous 18 to 24 gauge को हुन्छ. Question number 37. A nurse is using blood pressures of a patient using 2 large BP cup for patient. How the measurement of BP will be affected? Option A. BP will be falsely low. Option B. BP will be falsely high. Option C. BP will be too high. And option D. BP will be normal. The right answer is option A. BP will be falsely low. The most common error when using indirect blood pressure measuring equipment is using an incorrectly sized cup BP curve that is too large will give falsely low reading. Question number 38. If the patient is suffering from extreme hypothermia, what will be the body temperature of patient? Option A below 35 degrees Celsius. Option B above 35 degrees Celsius. Option C exactly 50 degrees Celsius. And option D none of the above. Extreme hypothermia ma below 35 degrees Celsius temperature huncha. Option A is right answer. Question number 39. When attending a client with a head and neck trauma following a vehicular accident, the nurse's initial action is to Option A do oral and nasal suctioning. Option B provide oxygen therapy. Option C initiate intravenous access. And option D immobilize the cervical area. Immobilize the cervical area. Initial action and the first action. Question number 40. The nurse is preparing to administer an internal feeding to a client via nasogastric feeding tube. The most important actions of the nurse is Option A. Verify correct placement of the tube. Option B. Check that the feeding solution matches the dietary order. Option C. Aspirate abdominal content to determine the amount of last feeding remaining in stomach. And option D. Ensure that feeding solution is at a room temperature. फिडिङ गराउनु भन्दा अगाडि चाहिँ मोस्ट इम्पोर्टेन्ट एक्सन कुन हुन्छ एउटा नर्सको भेरिफाई करेक्ट प्लेसमेन्ट अफ द ट्युब अप्सन ए इज राइट आन्सर क्वेशन नंबर 41 द नर्स इज केयरिङ फर अ क्लाइन्ट विथ अ सेरम पोटासियम लेभल अफ 3.5 MEq per L द क्लाइन्ट इज प्लेस्ड अन अ कार्डिक मोनिटर एन्ड रिसिभ 40 MEq KCl in 1000 ml of 5% dextrose in water IV. Which of the following ECG pattern indicate to the nurse that the infusion should be discontinued? Option A. Narrowed QRS complex. Option B. Shortest PR interval. Option C. Peaked T wave. And option D. Prominent U waves. Option C is the right answer. Question number 42. A nurse enters a client's room to discover that the client has no pulse or respiration. After calling for help, the first action the nurse should take is Option A. Start a peripheral IV. Option B. Initiate high quality chest compression. Option C. Establish an airway. And option D. Obtain the chest card. The right answer is initiate high quality chest compression चाहिँ दिनुपर्छ यदि चाहिँ पल्स र respiration छैन भने Question number 43 The cleansing of the stomach with solution delivered through a nasogastric tube is known as what? Option A. Gavage. Option B. Emesis. Option C. Lavage. And option D. Stomach pumping. It's known as lavage. Option C is right answer. Lavage means cleansing the stomach and gavage means feeding. केही कुरा एड गर्नु भनेको gavage र केही कुरा आउट गर्नु means lavage. Question number 44. A nurse is performing routine assessment of an IV site in a patient receiving both IV fluid and medications through the line. Which of the following would indicate the need for discontinuation of the IV line as the next nursing action? Option A. The patient complains of pain on movement. Option B. The area proximal to the insertion site is reddened, warm and painful. Option C. The IV solution is infusing too slowly, particularly when the limb is repeated. And option D. A hematoma is visible in the area of the IV insertion site. IV साइडमा इन्फेक्सन हुँदाखेरि डिस्कन्टिन्युएसन गर्नुपर्छ र यसको साइन सिम्पटम्समा रेडेड वार्म एन्ड पेनफुल हुन्छ अप्सन बी इज राइट आन्सर क्वेशन नंबर 45 When assessing a patient for fluid and electrolyte balance the nurse is aware that The organs most important in maintaining this balance are the option A. Pituitary gland and pancreas, option B. Liver and gallbladder, option C. Brain, stem and heart, option D. Lungs and kidney. The right answer is option D. Lungs and kidney. Question number 46. Which type of solution causes water to seep from the cell into the plasma? Option A. Hypertonic, option B. Hypotonic, option C. Isotonic, and option D. Alkaline. Option A is right answer. Question number 47. A nurse role in a consent is to. Option A. Explain the procedure. Option B. Witness the voluntary signature. Option C. Advise the patient on the best choice to make. Option D. To inform the patient of the surgeon's faults. The right answer is option B. Witness the voluntary signature. Question number 48. Kala-jar is caused by ... vector. Option A. Malaria. Option B. Sandfly. Option C. Housefly. And option D. bee. Kala-jar is caused by sandfly. Question number 49. The concept of primary healthcare started in the year. Option A. 1970 AD. Option B. 1960 AD. Option C. 1978 AD. And option D. 1878 AD. The concept of primary healthcare started in the 1978 AD. Option C is right answer. Question number 50. Which of the following is a vector of malaria? Option A. Culex mosquito. Option B. Anopheles mosquito. Option C. Sandfly. And option D. Aedes mosquito. Vector of malaria is a Anopheles mosquito. Female Anopheles mosquito. Question number 51. Protein energy malnutrition is mainly caused by deficiency of. Option A. Fat. Option B. Vitamin. Option C. Mineral. And option D. Carbohydrate and protein. Protein energy malnutrition is caused by carbohydrate and protein को deficiency ले. Question number 52. Family planning counseling should focus on. Option A. Inform and voluntary decision about contraception choice. Option B. Suggest use of appropriate contraception. Option C. Ensure couple to use best contraceptive method. And option D. Inform side effect of all the contraceptive methods. The right answer is option A. Informed and voluntary decision about contraception choice. Question number 53. All liquid waste containing human excreta is called. Option A. Sewage. Option B. shoelace. Option C. refuse. And option D. garbage. All liquid waste containing human excreta is sewage. Option A is right answer. यदि human excreta नभएर only all liquid waste भएको भए त्यहाँ sewage हुन्थ्यो र यदि चाहिँ human excreta पनि छ भने sewage. Question number 54. Measles is a viral infection. Mode of transmission of measles is. Option A. Airborne route. Option B. fecal-oral route. Option C. Direct contact. And option D. waterborne route. Option A is right answer. Airborne route बाट चाहिँ transfusion हुन्छ. Question number 55. The most common pathogen found in bladder and upper urinary tract is. Option A. Streptococcus pyogenes. Option B. Staphylococcus aureus. Option C. Salmonella typhus. And option D. E. coli. The right answer is option D. E. coli. Question number 56. In Torch syndrome, R stands for. Option A. Rubella. Option B. Rett syndrome. Option C. Rabies. Option D. Raynaud's disease. Torch syndrome refers to infections of a developing fetus or newborn by any of the group of infectious agent. टर्चको फुल फर्म हुन्छ टीबाट टोक्जोप्लाज्मोसिस, ओबाट अदर एजेन्ट, आरबाट रुबेला जसलाई जर्मन मिजल्स पनि भनिन्छ, सीबाट साइटोमेगालो भाइरस एन्ड एचबाट हर्ब सिम्प्लेक्स भाइरस। यसको राइट एन्सर हुन्छ आरबाट सोधेको छ, आरबाट रुबेला। अप्सन ए इज राइट एन्सर। क्वेसन नम्बर 57, immunological destructions of the body tissue or product due to antibodies reacting with it as an antigen is called. Option A anaphylaxis, option B autoimmune disease, option C prophylaxis, and option D immunodeficiency disease. The right answer is option B autoimmune disease. Question number 58. BCG vaccine is given to a newborn to protect from tuberculosis. BCG vaccine is option A killed vaccine, option B live attenuated vaccine, option C toxoid vaccine, and option D frozen vaccine. BCG is live attenuated vaccine. Option B is right answer. Question number 59. When administering an IV injection to an infant, the nurse in charge should use which side? Option A deltoid, option B dorsogluteal, option C ventrogluteal, and option D vastus lateralis. Vastus lateralis side चाहिँ युज गर्छ। अप्सन डी इज राइट एन्सर। इन्फेन्टको केसमा र एडल्टको केसमा आइएमको लागि डेल्टोइड मसल युज गर्छ। Question number 60. Which is the most characteristic features in the urine sediment of a patient with post-streptococcal glomerulonephritis? Option A epithelial cell, option B white cell cast, option C red blood cells and cast, option D marked proteinuria. Option C is right answer, red blood cell. Question number 61. The immunity that results from either a clinical or unapparent infections with a parasite is option A natural active immunity, option B artificial active immunity, option C natural passive immunity, and option D artificial passive immunity. इन्फेक्सनबाट इम्युनिटी गेन भएको छ, सो यो नेचुरल एक्टिभ इम्युनिटी भयो। अप्सन ए इज राइट आन्सर। क्वेसन नम्बर 62. The copper T IUD has an effective life of option A 5 years, option B 12 years, option C 7 years, and option D 2 years. नेपालमा आइयुडी सेकेन्ड जेनेरेसन चाहिँ युज हुन्छ र यो चाहिँ 12 इयर्सको लागि हुन्छ। अप्सन बी इज राइट आन्सर। क्वेसन नम्बर 63. Incubation period of diphtheria is option A 1 to 3 days, option B 2 to 6 days, option C 10 to 15 days, and option D 5 to 10 days. The right answer is option B. The incubation period of diphtheria is 2 to 6 days. Question number 64. Phlegra is characterized by diarrhea, dermatitis, and dementia. This condition is caused by deficiency of option A vitamin A, option B vitamin B, option C thiamine, and option D niacin. Option D niacin को डिफिसियन्सीले चाहिँ प्लेग्रा लाग्छ र यसको सिम्पटम्समा तीनवटा आउँछ, डायरिया, डिमेन्सिया एन्ड डर्माटाइटिस। यो भनेको भिटामिन B3 डिफिसियन्सी भयो। क्वेसन नम्बर 65. Which among the following is the primary focus of prevention of cancer? Option A elimination and conditions causing cancer, option B diagnosis and treatment, option C treatment at early stage, and option D early detection. The right answer is option A eliminations of conditions causing cancer. Question number 66. Who among the following are receptors of the secondary level of care done cancer cases? Option A those under early case detection, option B those under supportive care, option C those scheduled for surgery, and option D those undergoing treatment. The right answer is option A. Question number 67. Who among the following are receptors of the tertiary level of care for cancer cases? Option A. Those under early treatment. Option B. Those under supportive care. Option C. Those under early detection. And option D. Those scheduled for surgery. The right answer is option B. Question number 68. Habitual occurrence of disease is called endemic, sporadic, epidemic, and episodic. The right answer is option A. Habitual occurrence of disease is called endemic. Occasional occurrence of disease is called sporadic. Regular cases occurring in area is endemic अथवा habitual occurrence. Epidemic means unusually higher of cases in area, and pandemic means a global epidemic. Question number 69. The primary goal of therapy for a client with a chronic obstructive pulmonary disease is to: Option A. Correct the bicarbonate deficit. Option B. Increase oxygenation. Option C. Limit hydration. And option D. Improve ventilation. Improving ventilation provides comfort, maintains ejecting lung function, and prevents further lungs damage. Option D is right answer. Question number 70. A client visit in a prenatal clinic during the third trimester of pregnancy. The hemoglobin is 10 mg per dl and hematocrit is 34%. The nurse explains to this client that the decrease in the hematocrit is related to: Option A. Poor dietary intake of iron-rich food. Option B. Decreased cardiac output. Option C. The pathological anemia of pseudoanemia of pregnancy. And option D. Decrease in fluid in intravenous space. Option C is the right answer. Both vascular volume and red cell productivity increase in pregnancy. Question number 71. A 38-year-old female client has been diagnosed with hemorrhoid. Which of the following would most likely be primary causes of her hemorrhoid? Option A. 3 vaginal delivery pregnancy. Option C. Varicositis in her legs. Option C. Her age. And option D. Her job as a school teacher. The right answer is option A. Hemorrhoids are associated with a prolonged sitting or standing. Persons' hypertension, chronic constipations, and prolonged increased intra-abdominal pressure as associated with a pregnancy and the strains of vaginal delivery. Question number 72. A nurse is working on a nursing home floor when she smells smoke coming from a patient's room. He immediately runs in to inspect the non-smoking room and discovers a small fire in the client's trash case. This client has emphysema and has an oxygen tank by his bedside, with oxygen being delivered presently via nasal cannula. What would be the nurse's best action? Option A. Smother the fire in the trash cart. Option B. Pull the fire alarm. Option C. Grabs the fire extinguishers from the hall. And option D. Turn the client's oxygen off. First मा चाहिँ oxygen बन्द गर्नुपर्छ. Option D is right answer. Question number 73. When assessing an ECG, the nurse notes that PR interval represents the time it takes for the: Option A. Impulse to being atrial contraction. Option B. Impulse to transverse the atrials to the AV node. Option C. AC node to discharge the impulse to being atrial depolarization. Option D. Impulses to travel to the ventricle. Option D is right answer. The PR interval is measured on the ECG strip from the beginning of the P wave to the beginning of the QRX complex. It is the time it takes for the impulse to travel to the ventricle. Question number 74. A client is receiving spironolactone to treat hypertension. Which of the following instructions should the nurse provide? Option A. Eat foods higher in potassium. Option B. Takes daily potassium supplements. Option C. Discontinue sodium restriction. And option D. Avoid salt substitute. Option A is right answer. A client enters the ER complaining of a severe chest pain. A myocardial infection is suspected. A 12-lead ECG appears normal, but the doctor admits the client for further testing until the cardiac enzyme study are returned. All of the following will be included in the nursing care plan. Which activity has the highest priority? Option A. Monitoring vital sign. Option B. Completing a physical assessment. Option C. Maintaining cardiac monitoring. And option D. Maintaining at least one IVSS site. The right answer is option C. Maintaining cardiac monitoring. Even though initial tests seem to be within normal range, it takes at least 3 hours for the cardiac enzyme studies to register. In the meantime, the client needs to be watched for bradycardia, heart block, ventricular irritability, and other arrhythmia. Other activities can be accomplished around the MI monitoring. Remaining question next set ma. Thank you so much and all the best to all.